Hello and welcome to What Family Caregivers Need to Know video show by eCareDiary.com. I'm Susan Baida, the co-founder of eCareDiary and your host for today's show. I'm very excited to be talking about a topic that is top of mind for many of us during the holidays, and that is eating. And I'm very pleased to have as our guest Dr. Jaclyn Herring. Dr. Jaclyn Herring has been a clinical psychologist for 22 years, and she has studied at the University of Pittsburgh as well as Harvard Medical School. She is also a partner and practicing psychologist at Malik, Herring, and Krause in Mars, Pennsylvania, and she has developed a fascinating program called the Hearing and Heeding Your Hungers, a diet liberation course. I can't think of a more appropriate time to talk about eating than the holidays. Thank you for joining us.
Well, thank you for inviting me.
You can find out more about Dr. Herring and the Diet Liberation course through dietliberationcourse.com. So, Dr. Herring, tell us, what is it about eating and being a caregiver and having multiple responsibilities while you're caring for an aging parent or a child?
Well, I think there are two broad categories that affects eating. The first is that when you are a caregiver, you are expending a lot of resources, both internal and external. So external, like money and time, and internally, emotions and feelings about, the situation that you're in. So, but the time and the money may have people decrease the amount of self-care that they give, and this is particularly true of women. That's what the research says, is that...
I'm nodding because I relate.
When women are caregivers, they tend to pull back on their own self-care. So we don't exercise as much, we don't sleep as well or as much, and our eating is affected. And the eating can be affected by what we eat, more processed food, more fast food, not cooking as much, and that will affect what we eat, and therefore our weight can be affected by that. The weight is also affected by sleep and exercise, obviously. Sure. So that's one broad category, is that general, we don't have as much time. Then there's another category that I'm more interested in, and that's the psychological part that comes when you're a caregiver to people that you have a history with, a family history with. So there's nothing like eating. People try to compare it to drugs or other kinds of substances. The truth of the matter is we have been eating since before we were born, and influences have been pushing on us for around eating since we were little. So we have learned certain things in our family history. So eating can be used for reward, can be used for punishment, can be used for compliance, it can be used to please people, it can be used to anger people. All of these things and more, it can be used to cope. And when you are back in an environment with some of those people who, from your family history, we tend to revert back to some of those behaviors and those habits.
So, for example, mom wouldn't let you leave the table unless you finished everything on your plate.
Yes, and now all of a sudden you are back to the clean your plate club when you're an adult. When you had given it up for a long time, you were able to throw food away, or you were able to pack it away, or you were able to eat dessert without finishing everything. Now you're caring for her, and you find yourself finishing everything on your plate and eating dessert, or finishing everything on the plate and then feeling guilty about what you're choosing. So that's the second kind of broad category of why eating is affected when you're in that caregiver position.
Well, that makes a lot of interesting sense. Now, so what happens to family caregivers is that they're now in this role of caring for their parent or maybe their spouse, but let's use parent as an example. And but there's a little bit of role reversal too, a little bit, right?
Yes. Yes. So all of a sudden you may go back to those rules of your mother when you were trying to get her to eat. Right?
Right, and then, right, because that could be the issue too. They don't want to eat.
don't wanna eat.
And as they get older, they sometimes, I find, lose their appetite.
Yes.
I'm certainly seeing that with my own mom. Why is, I mean, I think it makes sense why mindful eating, but talk to us about mindful eating. Tell us what you mean by mindful eating.
Okay. Mindful eating is a very simple concept. It means to bring all of your attention and all of your focus to your eating when you are eating. Okay, so you slow down the eating process and you pay attention with a laser sharp focus to your food. So that starts even before you eat. You look at your food, you pay attention to what it looks like, you smell your food. And then you begin to eat and you do it in a slow process and you pay attention to all the things that are going on in your mouth and in the body as you eat. Okay, that's mindful eating. It also means that you are picking things that you like to eat. It means that you are paying attention to your hunger and fullness instead of the clock on the wall says it's time to eat or I'm not supposed to eat after 6 o'clock. It really is paying attention to the whole body when you're eating. It means not doing anything else while you're eating, which is often for caregivers the hardest thing. When I talk to people, they talk about eating when they're driving, eating when they're walking. So mindful eating is about just eating when you're eating and paying attention only to the eating.
How do you do that when you are pulled in multiple directions and there's limited time? What would you say would be the first thing, I mean, for someone who really just doesn't do any mindful eating at all? They're eating on the go, they're eating in their car, they're eating while they're driving, they're eating the leftovers of what their kids didn't finish or what, so how does a person just even begin to start that process? Because for a lot of us, I think that would be a big shift.
Yes. So when people are having real difficulty with this, I start them with one meal a day. So we pick the meal where they tend to have a little more time. Often it's breakfast, but sometimes it can be lunch or even dinner, depending on what's going on. And we work on sitting down. That's the first thing. Sit down when you eat. Don't stand up, because the research shows you eat faster when you're standing than when you're sitting. Okay? You eat faster and you eat more when you're watching TV, when you're driving, when you're listening to music, and when you're talking to people. Okay, so with breakfast, for instance, that tends to be a relatively short meal. You can do it in 10 minutes mindfully. So can't you really afford 10 minutes to eat mindfully? Okay, so let me just tell you what some of the benefits are to doing that, to eating mindfully. We know, first of all, that people eat less. When eating is sort of all tied into your brain and the body, and there's something about your memory and remembering the taste, and that satisfies you, and you tend to stop eating. Research also shows that insulin resistance is up with fast eating. So even people who are not diabetic or aren't on that path, their insulin resistance is affected when they eat fast. The signals that you are full and satisfied seem to be turned off when you eat fast. Okay. So you're not even going to recognize those signals that say, stop, I'm full. There are benefits if someone binges. They tend to really diminish significantly the binging that's going on if they're eating mindfully, and you just tend to eat less. So I start people with one meal a day and then try to expand it. And when we really talk about the amount of time that it takes to do this, 10 to 15 minutes, it's not a lot of time.
Absolutely. 10 to 15 minutes in a very busy day is certainly not a lot of time. So, well, thank you. These are incredible tips. I hope that many of you can walk away from this video with some of those great suggestions. And I want to thank you so much for joining us today and sharing mindful eating during the holiday season. And I would love to have you back to talk maybe about what we can do in the spring when there's less of the temptation, I think, before us. Thank you again for joining us. This is eCareDiary.com. Until next time, bye-bye.